First, we'd like to discuss the many medical issues which Doctors Without Borders, or DWB, addresses in their efforts. In clinical settings, the humanitarian group focuses on preventative care campaigns, providing complex medical care, and advocacy for affordable, high-quality medicine for some of the poorest populations in the world. According to the American College of Preventive Medicine focuses on the health of the individual, communities, and defined populations. Its goal is to protect, promote, and maintain health and well-being in order to prevent disease, disability, and death. One of the greatest contributions which DWB makes to the countries it serves is to provide this preventative medicine and prevent medical issues from arising, which would be much more difficult to care for once they progressed. DWB provides vaccination clinics to immunize patients against disease, education to inform patients on how to avoid infection, and nutritional resources to give patients strength to resist disease. Now, this sort of preventative care is incredibly important. According to DWB's official website, 8 children die every minute because their diet lacks essential nutrients. They will continue to do so unless food aid changes. 8 children a minute, not because of some terrible injury, but because they simply lack the food to resist starvation and disease. In regards to vaccination, their official release states, in 2014, DWB vaccinated 1,500,000 people in response to measles outbreaks. That's 1.5 million possible deaths prevented with vaccines. Now, had these people not been vaccinated and went on to contract the measles, it would have been much more difficult to treat. That's the idea of DWB's preventative medicine. Stop the medical issues before they progress to fatal stages. On a more direct scale, DWB also provides complex medical care to patients. According to their official release, every minute, 1 woman around the world dies from pregnancy or childbirth complications. In more than 20 countries, Doctors Without Borders focuses on reducing maternal and infant mortality. In addition, they will provide life-saving surgical treatment to patients who may have either sustained an injury as a result of conflict or simply have a surgical issue which cannot be paid for or treated in their country. Lastly, DWB cares for a multitude of neglected diseases, including Chagas, cholera, Ebola, fistula, HIV and AIDS, Kala-Azar, malaria, measles, meningitis, mental health issues, sleeping sickness, and tuberculosis. Now, many of these diseases can be prevented through immunization, treated with daily pharmaceuticals, or they're downplayed due to some sort of stigma. For these reasons, more developed nations do not consider them as much of a threat, and they become neglected. Through intervention, DWB treats these patients for these neglected diseases, and they prevent and assist in epidemics. Now, lastly, DWB advocates for low-cost and high-quality medicine in poor countries. In a recent DWB outreach campaign called A Fair Shot, they write an open letter to big pharma companies. They say, a child dies of pneumonia every 35 seconds. Your companies, Pfizer and GSK, make an effective vaccine to prevent pneumonia, but still 75% of children around the world remain unprotected against the disease. One key barrier is the high price. Now, through advocacy and awareness raising, DWB attempts to lower the cost of vaccines and life-saving but expensive drugs for diseases such as HIV and AIDS. Now, in many poor countries, patients seek other ways to acquire these medications. They need them through a sort of black market, and this leads to fake or low-quality medications being purchased for low prices, which further exacerbates the problem. DWB campaigns aim to prevent this underground fake medicine market and treat those in need with affordable and quality medicines. Now, as a nonprofit organization, none of this incredible medical assistance which DWB provides can happen without your help. By donating or taking the time to help raise awareness for one of these problems, which DWB advocates for over the internet, you can help to save lives as well.